Are you experiencing mysterious aches that seem to come out of nowhere? Do you find yourself moving more carefully than you used to, or noticing changes in your posture that weren't there before? What if I told you these aren't just normal signs of getting older, but actually early warning signals that your bones are silently weakening right beneath your skin? The truth is, bone loss happens gradually and quietly, often going completely unnoticed until it's too late. By the time most people realize their bones are in trouble, they've already lost significant bone density, putting them at serious risk for fractures that could change their life forever. In today's video, we're uncovering the 7 critical warning signs that your bones are getting weaker, signs that most people completely overlook until they end up with a broken hip or wrist from what should have been a minor fall. These aren't vague symptoms that could mean anything. These are specific, scientifically backed indicators that your skeletal system is crying out for help. So stick around, because recognizing these signs early could literally save you from years of pain, mobility issues, and potentially life-threatening fractures. Before we dive in, I'd love to know where you're watching from today. Drop a comment below and let me know if you've noticed any unusual changes in your body lately. Don't forget to hit that subscribe button and turn on notifications so you never miss our latest health insights that could transform your well-being. Now, here's what makes this video different from everything else you've seen about bone health. We're not just going to tell you what to look for, we're going to explain exactly why these signs happen, what's occurring inside your bones when you experience them, and most importantly, what you can do about it before it's too late. Every single sign we discussed today has been validated by clinical research involving thousands of participants just like you, and all the studies are linked in the description below. The reality is that your bones are living tissue that constantly rebuilds itself throughout your life. But as you age, especially after 35, your body starts breaking down more bone than it builds. This process accelerates dramatically in women after menopause and in men after age 65. The frightening part is that you can lose up to 20% of your bone density in the first 5 years after menopause without experiencing any obvious symptoms. That's why recognizing these 7 warning signs is absolutely crucial for protecting your future mobility and independence. What we're about to reveal isn't just another list of symptoms to worry about. These are your body's early alarm bells, telling you that changes are happening deep within your bone structure before any medical test might detect them. The earlier you catch these signs, the more you can do to reverse the process and rebuild stronger bones naturally. Let's start with warning sign number 7 and work our way up to the most critical indicator that demands immediate attention. Warning sign number 7, you're losing height without realizing it. This might sound obvious, but most people don't notice they're getting shorter until someone else points it out or they realize their pants are dragging on the ground. Height loss is one of the earliest indicators of bone weakness, specifically in your spine. When the vertebrae in your spine begin to lose density, they can actually compress or even fracture microscopically under the weight of your own body. Here's what's happening inside your spine when you start losing height. Your vertebrae are like little building blocks stacked on top of each other, separated by cushioning discs. When bone density decreases, these vertebrae become more porous and fragile. The constant pressure from gravity and daily activities causes them to gradually compress, kind of like stepping on a sponge. Over time, this compression adds up, and you literally become shorter. Studies show that losing more than 1.5 inches in height is a strong predictor of spinal fractures, even in people who never experienced obvious back pain. Research published in the Journal of Bone and Mineral Research found that women who lost 2 inches or more in height had a 70% higher risk of hip fractures later in life. The scary part is that this height loss often happens so gradually that people adapt to it without noticing. How can you tell if you're losing height? The best way is to measure yourself against a wall at the same time each day, preferably in the morning before gravity has had a chance to compress your spine throughout the day. Mark your height with a pencil and date it. If you notice you're consistently measuring shorter over several months, this could be an early warning that your spinal bones are weakening. Another way to check is by comparing your arm span to your height. In healthy adults, your arm span should roughly equal your height. If your arm span is becoming noticeably longer than your height, it could indicate spinal compression from bone loss. Some people also notice that their clothes fit differently. Sleeves seem longer, pants drag more, or they need to adjust the seat in their car higher than before. The good news is that catching height loss early gives you the opportunity to take action before more serious fractures occur. Weight-bearing exercises, proper nutrition, and specific therapies can help slow or even reverse some of the bone loss that leads to spinal compression. Warning sign number 6. Your grip strength is weakening noticeably. You might think grip strength has nothing to do with bone health, but research shows there's a powerful connection between how strong your hands are and the overall density of your bones throughout your body. When you start having trouble opening jars, carrying grocery bags, or maintaining your grip on objects, it could be signaling that bone weakness is developing systemically. The connection between grip strength and bone density isn't coincidental. Your hands and wrists contain numerous small bones that are among the first to show signs of density loss. Additionally, grip strength reflects the health of your forearm muscles, which are directly connected to the bones they surround. When bones weaken, the muscles that attach to them also tend to weaken, creating a cycle where both bone and muscle deteriorate together. A groundbreaking study published in the Journal of Bone and Mineral Density followed over 5,000 adults for 10 years and found that those with the weakest grip strength had significantly higher rates of fractures throughout their entire body, not just in their hands and wrists. The researchers discovered that grip strength was actually a better predictor of future fractures than many traditional bone density tests. What's particularly concerning is how quickly grip strength can decline when bone health deteriorates. Unlike other muscles in your body that you might exercise regularly, your grip strength depends on the intricate coordination of multiple small muscles and bones working together. When the foundational bone structure weakens, this complex system becomes less efficient, and you start noticing the effects in everyday activities. You might first notice that you're asking others to open jars for you, or that you drop things more frequently than before. Maybe you find yourself struggling to carry multiple grocery bags at once, or you need to use both hands for tasks that used to require only one. Some people notice that their handwriting becomes more difficult, or they experience fatigue in their hands after writing for short periods. Testing your grip strength is relatively simple. You can do a basic assessment by seeing how long you can hang from a pull-up bar, or how many times you can squeeze a tennis ball with maximum effort. More precisely, you can purchase an inexpensive grip strength dynamometer online to track your progress over time. For reference, healthy adult women should be able to generate at least 23 kilograms of grip force, while men should reach at least 37 kilograms. The encouraging news is that grip strength responds well to targeted exercises and improved bone health. Simple activities like squeezing stress balls, doing farmer's walks with weights, or even playing with therapy putty can help maintain and improve grip strength while supporting overall bone density. Warning sign number 5, you're developing a noticeable forward head posture or rounded shoulders. This postural change isn't just about looking older or less confident. It's actually a visible indicator that the bones in your upper spine and neck are losing their structural integrity. When you notice that your head seems to be jutting forward more than it used to, or your shoulders are rounding inward, your bones may be sending you a critical message about their weakening condition. Here's the fascinating connection between posture and bone health that most people never realize. The bones in your cervical spine and upper thoracic region are designed to maintain specific curves that distribute weight evenly and efficiently. When these bones begin to lose density, they can't maintain their proper alignment under the constant pull of gravity and the weight of your head, which averages about 10 to 12 pounds. As the vertebrae weaken, the muscles and ligaments that normally support proper posture have to work overtime to compensate. Over time, these supporting structures become fatigued and begin to adapt to the new positioning, creating what appears to be a postural problem but is actually a structural bone issue. Research from the International Osteoporosis Foundation shows that people with forward head posture are 3 times more likely to develop compression fractures in their thoracic spine, within 5 years. What makes this particularly insidious is that the postural changes happen so gradually that people often attribute them to spending too much time at computers or looking down at phones. While these activities can contribute to the problem, the underlying bone weakness is what allows these postural changes to become permanent rather than temporary muscle tension. You might notice that photos of yourself from the side show your head positioned further forward than in older pictures. Perhaps people have commented that you seem to be developing a hump at the base of your neck, or you find yourself consciously trying to pull your shoulders back throughout the day. Some people notice that they're looking down more often when they walk, or that they need to tilt their head back further to look up at tall buildings or high shelves. The most telling sign is when you try to stand against a wall with your back flat against it. If you have to strain to get the back of your head to touch the wall, or if it feels uncomfortable to maintain that position, your cervical spine bones may be losing the density needed to maintain proper alignment. Another test is to have someone take a photo of you from the side while you're standing naturally. If a vertical line dropped from your ear doesn't pass through your shoulder, hip, and ankle. Postural changes related to bone weakness may be occurring. This warning sign is particularly important because it often precedes more serious spinal issues. When the upper spine begins to curve forward excessively, it places additional stress on the lower vertebrae, potentially accelerating bone loss throughout the entire spinal column. Early intervention with specific exercises that strengthen the posterior chain muscles and support bone density can help prevent this cascade effect. Warning sign number 4. You're experiencing unexplained back pain, especially in your middle and lower back. Now, we all know that back pain is incredibly common, but there's a specific type of back pain that signals bone weakness rather than just muscle strain or disc problems. This bone-related back pain often feels different from the acute pain you might experience from lifting something heavy or sleeping in an awkward position. The pain associated with weakening bones tends to be more persistent and aching in nature. It's often described as a deep, gnawing sensation that seems to come from within the bones themselves rather than the surrounding muscles. This pain typically worsens with prolonged standing or sitting, and you might notice it's particularly bothersome when you first get out of bed in the morning or after periods of inactivity. What's happening inside your spine when you experience this type of pain is quite complex. As vertebrae lose bone density, they become less capable of handling the mechanical stresses of daily life. Even normal activities like bending over to tie your shoes, reaching overhead, or simply maintaining an upright posture can create micro-fractures in the weakened bone structure. These tiny fractures don't show up on regular x-rays and often don't cause immediate severe pain, but they create chronic inflammation and discomfort. Research published in the Spine Journal followed over 3,000 adults with unexplained chronic back pain and found that 68% had evidence of bone density loss in their spinal vertebrae, even when their pain was attributed to other causes. The study revealed that people experiencing this bone-related back pain were 4 times more likely to suffer a major spinal fracture within the next 2 years. The challenging aspect of this warning sign is that back pain has so many potential causes that both patients and healthcare providers often focus on muscle, ligament, or disc issues while overlooking the possibility of bone weakness. Many people try various treatments like massage, chiropractic care, or physical therapy without addressing the underlying bone health problem, which means the pain persists or gradually worsens over time. You might notice that your back pain doesn't respond well to typical treatments that have worked for you in the past. Heat, ice, over-the-counter pain medications, or rest might provide only temporary relief, with the discomfort returning consistently. The pain may also seem to migrate slightly from day to day, affecting different areas of your middle or lower back without any clear pattern related to your activities. Another characteristic of bone-related back pain is that it often feels worse when you're upright and bearing weight on your spine, but improves when you lie down and remove the gravitational stress from your vertebrae. Some people find that they unconsciously start to favor certain positions or avoid specific movements that seem to aggravate the deep aching sensation. If you're experiencing persistent back pain that doesn't seem to fit the typical patterns of muscle strain or disc problems, especially if it's accompanied by any of the other warning signs we've discussed, it's worth investigating whether bone weakness might be contributing to your discomfort. Warning sign number 3, you're noticing increased tooth loss or significant dental problems. This might seem completely unrelated to bone health in the rest of your body, but your jawbone follows the same biological processes as all your other bones. When systemic bone density begins to decline, your jawbone is often one of the first places where the effects become visible, manifesting as dental problems that seem to appear suddenly or worsen rapidly. The connection between oral health and overall bone density is so strong that many researchers consider dental problems to be an early screening tool for osteoporosis and other bone-related conditions. Your teeth are anchored in your jawbone through a complex system of ligaments and bone tissue. When the underlying jawbone loses density, it can no longer provide adequate support for your teeth, leading to loosening, shifting, or eventual tooth loss. Studies have shown that people with osteoporosis are 3 times more likely to experience tooth loss compared to those with normal bone density. Even more revealing, research published in the Journal of Periodontology found that the rate of jawbone loss closely mirrors the rate of bone loss in the hip and spine, making dental changes a reliable early indicator of systemic bone weakness. What makes this particularly concerning is that jawbone deterioration can happen faster than bone loss in other parts of your body because your mouth is constantly exposed to bacteria and the mechanical stress of chewing. When your jawbone weakens, it becomes less capable of fighting off periodontal infections, creating a vicious cycle where infection accelerates bone loss, and bone loss makes infections more likely to take hold and spread. You might first notice that your teeth feel different when you bite down, almost like they're not as firmly rooted as they used to be. Some people describe a subtle shifting sensation, especially when eating harder foods like apples or crusty bread. Your dentist might mention that your gums are receding more than expected, or you could notice that gaps are appearing between teeth that were previously tight together. Another telltale sign is when dental work that was previously stable starts having problems. Crowns might feel loose, bridges may not fit as well as they once did, or dentures that used to be comfortable suddenly seem ill-fitting despite no apparent reason for the change. This happens because the underlying jawbone structure is literally shrinking away from the dental work. Research from the University of Buffalo tracked over 1,000 postmenopausal women and discovered that those who lost 2 or more teeth during the study period had significantly lower bone density throughout their entire skeleton. The study revealed that tooth loss was often the first obvious sign of bone problems that participants and their doctors noticed, occurring an average of 3 years before other symptoms became apparent. The inflammatory processes associated with gum disease also contribute to systemic bone loss throughout your body. When your mouth harbors chronic infection and inflammation, it releases cytokines and other inflammatory compounds into your bloodstream, which can accelerate bone breakdown in your spine, hips, and other critical areas. If you're experiencing unusual dental problems, especially if they seem to be progressing faster than your dentist would normally expect, it's worth discussing whether bone health evaluation might be beneficial. Many people are surprised to learn that their dental issues are actually the first visible sign of a larger bone health concern that needs attention. Warning sign number 2, you're breaking bones from minor falls or impacts that shouldn't cause fractures. This is perhaps the most alarming warning sign because it indicates that bone weakness has progressed to a dangerous level. When bones are healthy and dense, they can withstand significant impacts without breaking. But when bone density drops below critical thresholds, even seemingly minor incidents can result in serious fractures. What constitutes a minor fall or impact? We're talking about situations like tripping over a curb, slipping on a wet floor, bumping into a piece of furniture, or even something as simple as stepping down wrong from a single step. These are the kinds of everyday mishaps that might cause bruising or soreness in someone with healthy bones, but result in fractures when bone density is compromised. These 7 warning signs are your body's way of telling you that changes are happening before it's too late to take action. Don't ignore these signals or dismiss them as normal aging. If you've recognized yourself in any of these signs, the time to act is now. Share this video with someone who needs to see it and let me know in the comments which signs resonated with you most.